Hi everyone, Dr. Cary Yurkiw here. Thank you for joining us today for our webinar on back pain. And this is part of our webinar series that we do on Wednesdays. And it's on different conditions we see in the clinic. That includes back pain. It could also include neck pain, other spinal pain. We've done mid-back and the ribs, as well as other joints in the body and conditions like sciatica, carpal tunnel, headaches. So it's all the things that we see in the clinic as far as patients coming to see us in the clinic and what we can do to help them. My name is Dr. Cary Yurkiw. I'm a chiropractor in Kelowna, British Columbia. I've been practicing for over 25 years now, and I've seen thousands of patients in my clinics. I've done over 100,000 adjustments. Basically to all joints of the body. That includes the spine and the peripheral joints like the wrists and the elbows, TMJ, the jaw joint, the knees, the ankles, the feet. And I practice at Landmark 4, which is the tall glass towers in Kelowna. We're right in the middle of the three glass towers, Landmark 3, 4, and 5. And we're currently accepting new patients. So if you're interested in coming to our clinic, we'll put a link in our post and you can easily just click on the link and book an appointment. So today we want to talk about back pain, what causes back pain and how we can help. And back pain is caused by strain to an injury to the back. So sometimes you're lifting or maybe you're snow shoveling or working and shoveling or twisting, and that can cause injury to the back area. It can affect the muscles, can also affect the nerves, and it can affect the other structures like the discs in between the bones. Strain is a result of overuse of an area. So if you're repetitively using one area, if you're lifting and twisting, it's hard on the back because the shovel, in this case, works like a long lever, long arm, and it really torques the low back. So it can really overwhelm the back and cause injury. Twisting is really hard on the discs, especially. This can result in local pain in the low back and then tightness of the muscles to the point where they can go into spasm or they can start to cramp. And sometimes we have patients coming into the clinic, they're kind of bent to one side or the other, depending on where the injury is. The muscles can get injured, and there's many layers of muscle in the low back. These are paraspinal muscles, ones running along the spine. They can get pulled, they can become very tight, and there can be misalignments underneath that cause the muscles to be off balance. Also, there's nerves in the lower back area, and these nerves are the sciatic nerve, which is one of the largest nerves in the body. It comes from the 5 nerve roots, from the 2 lumbar and the 3 sacral nerve roots, the tailbone area right here. And these nerve roots form a large nerve that travels down the buttock area, down the back of the leg to behind the knee and splits into 2. So there's the sciatic nerve, there's other nerves like the femoral and the obturator nerve that come out of the lower back as well. And those nerves go to the front of the thigh and into the musculature in the leg area. And this can cause referred pain. So numbness and tingling, cramping, problems with sensation, hot and cold. So a number of different symptoms can result. Pins and needles can result from pressure on these nerves. The sciatic nerve is definitely one of the biggest, and that can lead to pain and symptoms all the way down the leg, right to the tips of your toes. The discs are in between the bones, and the discs act like shock absorbers. They take up about 1/3 of the height of the vertebrae, and those discs are like jelly donuts. There's a fluid in the middle, there's a ligament or a dough on the outside, and these discs can adapt to the stresses being put on the spine as well as weight bearing and gravity. Sometimes though, If the spine's out of alignment, it can cause the disc to bulge, and that can squish that disc material and press on the nerve on one side or the other, or sometimes even both. So what can be done to help? Well, number one, we want to do a history when someone comes in. We want to understand their condition better. And by doing a history, this allows us to get the story behind the injury or the condition. When did it first start? How intense is it? Is it there all the time? Was there an injury, or were there multiple injuries? Is there genetic predisposition? So we want to know the whole history so we can get a better understanding of the patient's condition. And then we want to do an examination. And the examination includes ranges of motion, posture, orthopedic and neurological tests. And sometimes it involves an X-ray if that's necessary. If we're concerned about a pathology in the low back, we will take an X-ray. We have a digital X-ray unit in our clinic. So the X-ray will tell us more about the posture and alignment of the vertebrae. It'll tell us more about the condition of the vertebrae, if there's wear and tear, osteoarthritis. And it'll tell us more if there's any kind of pathology, a fracture or a tumor in the spine. So we really want to know more about the spine, and X-ray is an excellent tool for a diagnosis of spinal conditions. For treatment, as a chiropractor, we will often recommend adjustments, and those adjustments will be done by hand or using an instrument to realign the spine and the posture. It also increases the function of the spine, the range of motion, and this involves the spine and the disc, the nerves and muscles. It helps to reduce pain and reduce inflammation. So that's our goal when someone first comes into the clinic. Treatments also may involve muscles, and that could involve stretching muscles. It could involve strengthening muscles. And I reached out to a few people on social media this week, and Melanie M. Responded, and she's a local here in Kelowna. And she said what she often recommends is stretches for the low back, the attachments into the lower part of the spine, like the psoas muscle, the hamstrings, and using devices like a foam roller, tennis ball can help to relax the muscle and work out the tension. I also like to recommend stretches, and these stretches are for the spine. I like to recommend gentle stretches to start, often yoga type of stretches, and these exercises will help to stretch the muscles in the lower part of the spine. Also, strengthening the muscles in the low back is important, so strengthening the core, strengthening the muscles in the pelvic area, including even muscles that go into the leg, like the quadricep muscles and the hamstring muscles, can help to provide stability once the spine and the posture is corrected. I just want to make sure Melanie gets a shout out. She's at Abstract Fitness Canada, so if you go to @Abstract Fitness Canada on Instagram, you'll be able to find Melanie there. She gave us some tips, and we integrated that into our webinar today. So for posture, we like to give our patients advice as far as how they should stand and sit, even the way they should sleep. We like to give them exercises, and we like to give them supports, like sometimes a back belt or a wrap to go around their waist that'll help to keep the spine in a better alignment. As far as obstacles go, to care, patients, when they first come to the clinic, they want to know if it's going to hurt. So normally when we do adjustments on the spine, touching the area hurts, but when we do the adjustment, it actually feels a lot better. So most people feel relief after an adjustment. As far as the costs go, the first visit is a little more expensive. It's about half an hour in length, and we have to do the history and exam, sometimes take x-rays, and then explain what we found out, and we're going to do a treatment and then do the treatment. And sometimes people will ask us, well, how long will the treatment take, and how many visits do I have to come for? we like to put together a treatment plan fairly quickly. So after a few visits, we know how the patient's healing. We'll tell them what to expect as far as number of visits, over how long, and then we'll also tell them if they want to do some things for themselves, what they can do to support the healing process from home. The cost of the subsequent sessions is less than the initial session, and these sessions take less time. But then when we do a re-examination, we like to do those tests again, let the patient know how they're progressing, and then we will give them advice on what they can do to help themselves. If you want to book an appointment today, we are accepting new patients. I'm going to put the link for booking online in this post. We're offering 15% off the first visit. So if you want to take advantage of that offer, just go on the link and you'll get 15% off. This offer is good for 48 hours. So you can click on that link and book an appointment within the next 48 hours. And this offer is good for 2 weeks. As far as future webinars, we have a webinar on back pain coming up. That'll be in a few weeks from now. So there's one on mid-back pain, and we'll do this one on low back pain again. I did write a book on back pain. It's on Amazon. So you can go on Amazon, type in back pain in my name, and you'll be able to find that book. And it's in 3 formats: audio, ebook, and paperback. I also wrote a book on neck pain. You'll be able to find that on Amazon as well. And it's in the 3 formats that we just talked about. Other webinars that we'll be doing, there's going to be a webinar on joint pain coming up, so please join us for that webinar. We're going to do webinars on neck pain in the future, headaches, sciatica, foot pain, hand pain, and so there's a number of different webinars we'll be doing coming up. And if you have any suggestions on webinars you'd like us to cover, please put that in the comments. We'd be happy to find out what you're interested in and do a webinar on that if we can help that condition. Follow us on social media. We're at Dr. Cary Yurkiw on Instagram, Facebook, and Twitter. We do have a podcast, and this recording will be on our podcast channel. It's called SuperHealthy, and it's distributed through Apple, Spotify, and Google. We do have a YouTube channel, so if you go to at Dr. Cary Yurkiw, you'll find our YouTube channel. Our website is www.caryyurkiw.com, so feel free to go there. And again, the offer we're giving you is 15% off the first visit. This offer is good for the next 2 weeks, and you have to book this within the next 48 hours. So I'd like to thank you for joining us today. I hope you learned something about back pain. Thanks again, Melanie, for contributing and collaborating with us. And we look forward to seeing you next Wednesday at our next free webinar.